Hey everybody, we're here with Therapy Nexus. Today we're going to do a video on some specific exercises to strengthen your booty. Yeah, we have a lot of comments talking about after they get the dynamic brace, like, oh, my knee goes in, like, am I going to have pain in my knee and my hips and my back with the brace? And we're going to be going over some specific exercises to strengthen the gluteus medius muscle.
Yeah, some people made comments about, we gave a video about going up and down hill, and I said, how your knee or ankles turn in and out when you're walking, and you're trying to stop that. And some people said they would take smaller steps. They were told to do that, which is great. They also said that you use sticks, which is absolutely great when you're hiking. You definitely want to do that. But if you're just out walking and you don't, smaller steps work great, but it's not specifying the muscle we're trying to hit. And that's the whole point of it, is having a strong enough muscle where you can stand there in that one spot without having to take little small steps. Like I said, small steps are great, sticks are great, but we need to strengthen this muscle.
But we need to strengthen your butt.
Yeah, exactly. So,
yep. So we're going to do two videos. One video is going to be kind of the basic strengthening, and then we're going to do another advanced version, more balance, and because that muscle is supposed to hold you up against gravity. So if that muscle isn't holding you up, then you start to compensate, going side to side, or that knee goes in and out. So you need to have that muscle strong, so when you put weight on it, it's holding you up to take that another step. So, all right, I'm gonna have you lay on your side, facing the camera. And Wayne's gonna be my lovely patient. Okay, so most of y'all been to therapy many times. Y'all probably heard of the clam. So I'm gonna have you bend your knees. For any exercise, anything you do, you always want to activate your core and keep that back in a good neutral position. So he's tightening his core and he's in a good position. He's going to keep his ankles together, and all he's going to do is bring that top leg up. Whoa, whoa.
what? What's wrong?
Not like that. You're going to have to, if you want, you can put your hand right there. You bring that knee up. And you don't allow this to move.
A lot of people
this
will
is
rotate like this.
One unit. And if you have a wall, you can put your back against the wall, put your feet against the wall, and that will help you not rotate, not compensate.
Or a couch. You lay against the couch. Just your dog's gonna lick your face. Just know that.
Yeah. So yep, and then you can go up and down. And this is muscle. This is an exercise that you can go till fatigue. Really, it might be 10. It might be 15.
1 million.
It might be 50, but this is not going to cause any issues if you do too much of them.
Everybody wants the swole booty.
But a good, 2 sets of 20, maybe. All depends on what you can do. Because if you start compensating, then you stop. There's no reason.
Some of our patients have neurological disorders where they can't even pick their knee up. So this is something you have to work on, and it can be fixed for some people, unless you have a total severed nerve.
Yeah.
So.
Okay. Right, you can always add to this exercise. You can put a band around the knees.
Careful with the hair. Careful with the hair.
Careful with the hair.
There we go. This is a tight band, yo.
Okay. So, yep. There you go.
And this is where you want to feel it. Right here. You see, I'm not trying to feel it back here, or I don't feel it up in my spine. It's like literally like right.
Or hip flexor.
Yep. And I almost lean forward a little bit to keep myself from cheating and going backwards like that.
All right. So let's take this off. Eee! Okay.
Wow.
So to advance the exercise, you're going to have a longer.
You said you throwing that. If you have a leg weight at the house, you can throw that on your knee too. Something like, instead of a T-band, if you don't have T-bands.
You just have to be careful with your position. You do not want compensation. If you have compensation, you're not doing the right exercise, and then it's worthless. All right. So the next one is you're just going to keep the top leg straight. Bring the bottom leg. Bend it.
You bend the bottom leg. Okay.
Bend the bottom leg. And then you want to bring your toes towards you and pretend like you are kicking the wall closest to you. So you're going to kind of extend that leg.
The wall behind me?
Nope. Away from you.
That one way down there?
Way down there.
Okay, so I'm going to reach for that wall. Like I'm trying to
Yeah, but be careful with all of
tighten up my
this.
core.
Yeah. And then you're going to go up and down. Up and down.
Let me try. Is that how you do it?
No.
No?
You're going to slow it down. And you go up and down. Maybe 1, 2, up, 1, 2,
I'm
down.
just trying to show you what people compensate. That's what
And
I'm
you
trying
draw
to do.
those ribs down. You see those ribs coming out? You need to have that good neutral spine. You're going up and down. You feel it right here.
Oh
If
yeah.
you feel it in the front, that means you're rotating too much out. If you feel a lot in the hamstring, you might be compensating
No, sometimes you're too far
or
forward.
too far forward. So you have to get that sweet spot, and it's right here.
Oh, that's a sweet spot right there. It burns. It burns.
And this one I like going till to fatigue. So
It's
that
already
could
fatigued.
be 5, that could be 10. Like I said, it's up to you.
Yeah,
and
we
then the
see-
more you do it,
Yeah, I've seen a lot of people just literally like just. This ain't no Jane
Yep,
Fonda
and then
workout. Yeah.
yeah, no, because then
You reach and you're very specific about
Yep,
this.
you
And
draw.
if you look, the only joint movement is this. That is it. I'm trying not to move anything else but that, and I feel it here.
Yeah.
Okay. We wanted to mention this for when you're doing this, and if you can't pick your knee up because you have some type of a lot of weakness from neurological
neurological
injury.
weakness or
Yeah.
just you're not able to turn on that muscle specifically, this would be like a number 1 exercise to do.
So what we use is this is a furniture mover. You can get it at Lowe's, Home Depot, Amazon. I'll put a link in the bottom for it. And then also you can use plexiglass. You put like a towel underneath your foot and you can slide. But you need a big
Towel
piece
or
of plexiglass. If you got one,
pillowcase.
yeah. If you got one laying around, rock on. But if you don't, it's a lot easier to get a hold of.
Mm-hmm.
All right.
And this is activating the muscle without gravity.
Yeah, it's not. You're not lifting against gravity.
Right. So you put it underneath your heel. Remember, you always draw that belly button in. Bend that other knee that you're not using. You put your hands on your hips to make sure you're not compensating, and then you just bring it out and in.
And her toe is pointed straight to the ceiling. A lot of times people will kind of go like that. If they don't have it, they'll cheat by doing that and trying to roll it out. So keep it pointed up at the ceiling.
And then you can always add a resistance band to this.
Or
Going.
take it away. Take that out from underneath, then you got to drag your foot along the floor. That'll be a little more resistance until you can get on your side and pick up against gravity.
Yep, there you go.
Voila.
All right. So this is another one we're going to do. You're going to lay on your back. Everyone's done a bridge.
A bridge? Like that?
Yep. But we're going to add resistance to it. And this is a good one to incorporate more than one muscle group, right? Because the bridge, you're focusing on your glute max, so that extension. So do just a regular bridge.
When you do this, you want your feet together. Some people will try to be like this, but keep the feet together. I'd say so, because then you get the clam effect.
Okay.
So,
Yeah.
how do you do a bridge?
So always activate your core. You draw in your belly button, and you squeeze your bottom, and you lift your bottom up in a nice position. And then here, this is when you can bring the leg out. This is going to work on more of that gluteus medius muscle. But then you're also incorporating your glute max. So it's all encompassing. You got to make sure you breathe when you're doing any of these exercises. Nice and slow.
But it's so hard.
Nice and slow. And then this one, just do 20 in the beginning and see how you
10
go.
if you can.
Yeah, just depend on, if your back starts giving and you feel it in your hip flexors, anything, just kind of listen to your body and know the area that you are trying to target, which is your glutes. That's the main one that you should be focusing on. So that's going to be part 1, and check us out for the next video.
Yeah. And that's just, like we said, to correct that knee giving in or bowing out. You want to be able to be strong and be able to hold it.
Perfect.
Adios.
Bye.